Hello, everyone, and welcome right back to The Explainer. Today, we are pointing our spotlight at a deeply frustrating, incredibly complex, but honestly, utterly fascinating neurological condition. We're talking about apraxia. So, I want you to imagine for just a second, knowing exactly what you want to do, having all the physical strength to do it, but finding that your body simply refuses to follow the plan. No way around it, that is the daily reality for someone living with apraxia. It's a condition that basically just takes a pair of scissors and severs the line of communication between your intention and your action.
So here is our roadmap for today's explainer. We'll kick things off with understanding apraxia, then we'll look at the neurological causes, multifaceted treatment approaches, therapy and emotional support, and finally wrap up with maximizing independence.
All right, Section 1, Understanding Apraxia, the Paradox of Intention and Action. Let's get into it.
Okay, let's start by looking at this definition, just to establish a really clear clinical baseline for us. Apraxia is formally defined as a neurological condition that affects a person's ability to plan and perform learned movements. Now notice those key words in there, plan and learned. We are not talking about random twitches or basic reflexes here. We're talking about intentional, learned actions. Things a person has successfully done thousands and thousands of times before, suddenly becoming completely impossible to coordinate.
And this right here brilliantly illustrates that heartbreaking paradox. You see, a patient often has the absolute full physical strength to perform an action, and they completely understand the goal. But despite having that strength, and despite knowing exactly what they want to do, they struggle to physically execute it. The muscles work, the mind knows what's up, but the blueprint for the movement, it literally just gets lost in transit.
And because of that, this condition pervasively impacts just everyday life. We're talking dressing, grooming, eating, or even just doing familiar gestures. Tasks most of us take totally for granted suddenly turn into these monumental obstacles. You can see how quickly something like this steals a person's independence, right? It significantly affects their entire quality of life, which is exactly why early identification is just absolutely crucial.
Moving on to Section 2, the neurological causes, the brain's planning center.
So apraxia doesn't just appear out of nowhere. It is primarily associated with specific damage to the areas of the brain that handle planning and organizing movements. And as our source data points out, this damage usually occurs in the left hemisphere of the brain. When this specific planning center gets damaged, the brain can still send signals down to the muscles, sure, but those signals are completely scrambled. It's kind of like, well, actually, it's like having a fully functioning construction crew ready to build, but handing them a set of blueprints that are totally out of order. They have the tools, but no idea what step comes next.
All right, Section 3, Multifaceted Treatment Approaches, Mapping the Road to Recovery.
And this naturally brings us to the biggest question for anyone facing this diagnosis. How is apraxia treated? Well, as you can probably guess, it's not as simple as just taking a pill. Because the condition involves both the physical structure of the brain and those complex cognitive planning processes, the approach to rehab has to be incredibly comprehensive. Treatment is essentially built on three core pillars: biological treatment, daily life rehabilitation, and cognitive and psychological rehabilitation. Let's just break each of these down so we aren't completely overwhelmed by the medical jargon here. We'll start with the biological side of things.
Right out of the gate, doctors look to manage the underlying neurological problem directly at the source. So, biological treatment can include acute interventions like thrombolysis or mechanical thrombectomy. These are medical treatments doctors often use if the apraxia was triggered by something sudden, like a stroke. And alongside those acute measures, medical teams rely heavily on MRI-based assessments to literally map out the brain damage, all combined with regular neurological follow-ups just to keep a really close eye on the brain's physical status.
But, fixing the biology, that's really only the first step. The second pillar is daily life rehabilitation. Remember those everyday activities we talked about earlier? Well, this phase involves the grueling, repetitive practice of those exact survival tasks. We're talking practicing dressing, bathing, grooming, eating, oral care, toileting, and basic household chores. It sounds incredibly basic, I know, but this repeated practice is essential. It physically helps the person slowly improve their ability to execute these really necessary actions, day in and day out.
And then we have the third pillar, which I think is absolutely fascinating: cognitive rehabilitation. This is all about literally retraining the brain's movement planning systems. Therapists use some highly specialized strategies here. They do gesture training. They break down and sequence activities step by step so the brain doesn't just get totally overwhelmed. They use strategy training and something called errorless learning, which prevents the patient from processing their mistakes. They also lean on external cues like verbal instructions or visual demonstrations, which basically gives the brain an outside roadmap to follow when its internal roadmap is offline. Next up, Section 4, Therapy and Emotional Support, a holistic approach.
Look, it really takes a village to guide a patient's recovery journey, and different types of therapy support totally different parts of that recovery. Occupational therapy hones right in on daily functioning and independence. Speech-language therapy steps in if there are communication difficulties tangled up with the apraxia. And physiotherapy, that provides the vital foundational support needed for overall movement and coordination. It's a massive team effort, targeting every single angle of that brain-body disconnect.
And what's truly exciting right now is just how rapidly the whole field of rehabilitation is advancing. Researchers are currently exploring some really cutting-edge stuff, like TDCS, virtual reality, and computer-assisted therapy, all to further support and enhance those traditional methods we just talked about. The tools we have to retrain the brain are getting more sophisticated literally every single day.
But having said all that, all the cutting-edge tech in the world doesn't replace the human element. Emotional support, family involvement, and internal motivation are absolutely critical, mainly because apraxia is just deeply, deeply frustrating. Seriously, imagine trying and failing to button a shirt when you know exactly how it should be done. The frustration is immense. Treatment really only hits its stride when it addresses not just the movement issues, but the person's psychological and emotional needs too.
And that brings us to Section 5, Maximizing Independence, the Ultimate Goal.
Okay, we have to deliver the realistic but hopeful truth regarding the current medical consensus. Right now, as of today, there is no definitive cure for apraxia. You can't just wave a wand and erase damage to the left hemisphere. However, the hope really lies in the process itself. Early diagnosis, coupled with consistent, dedicated rehabilitation, absolutely can and do help improve a patient's functional abilities over time.
But I want to emphasize this heavily. There is no one-size-fits-all approach here. Because the human brain is so wildly complex, every single recovery plan must be highly customized. How well someone responds to treatment depends on so many distinct factors. Things like the specific type and severity of their apraxia, their age, their individual learning abilities, their internal motivation, and, as we just discussed, the sheer strength of their family support. Every single one of those elements requires a deeply individualized plan.
And that leaves us with this final, vital thought to reflect on today. Since there isn't a single magic bullet cure, how can we best tailor our medical, our technological, and our emotional support to maximize a patient's independence and overall quality of life? It's a question that reminds us that at the very heart of all this complex neurology and rehabilitation is a profound human element, a person just trying to regain control of their everyday life. Thank you so much for joining me for this explainer, and as always, keep learning.